Hello, Mia. I'm so excited to have you here and that you'll be commenting and talking about what is so important about the mouth health, oral health, dental health, and how it relates to bone health and how the osteoporosis drugs may impact bone health, osteonecrosis. So I'm going to ask you if you can introduce yourself and tell my audience who you are. I will say how delightful you are, but tell us who you are and how you came to the mouth.
Hello, Irma. Thank you for making this possible. I feel really honored and I must say comfortable. I'm a long-living plant with a few careers in my luggage. So my first half of life was pediatric dentistry and preventive dentistry, teaching and working and mentoring in university settings for almost 20 years, from early 90s to mid 2000. When I've decided to settle in Canada, to live with my family in Montreal. And over here, I reached out for the preventive part of the dentistry, which is my real passion, and it's my life philosophy.
And what is the impact on breathing with a mouth, open mouth through the night?
Mm-hmm. Well, the thing is that today we have, thanks to our lifestyle, we have mouth which is narrower than can accommodate all the structures in the mouth properly, meaning all the teeth. So we often see crowding, orthodontics is flourishing. And also the space for the tongue becomes also very constrained. So the thing is why it's important, because tongue naturally has to go forward and the lower jaw has to grow forward. Otherwise, everything will be placed back on the halfway, of the airways. And this is a very simplified, extremely simplified explanation, but it can affect our ability to breathe through the nose. It's important to know that when we breathe through the nose, that's one tube, and it goes to trachea, and it goes to lungs, and picks up gives the oxygen to the blood that goes directly to the brain. When we breathe through the mouth, only part of the air manages somehow to go to the lungs, but the majority goes to the stomach. So it's half solution of breathing. It's not ideal, it's not natural.
Is there a remedy for mouth breathing?
Ideally, when the baby is born or the child is young, we can measure the distance between baby molars and to know if that's a narrow space or we need to expand it. So expansion of the palate is a big deal. Then we have a set series of exercises which are part of the myofunctional oral therapy, and very exciting thing because it gives fantastic results where we exercise with our tongue to place it forward. And sometimes we can see that our connections, the skins under the tongue or on the sides of our cheeks to the gums or here where the lip is, are very short. So releasing those with very simple, elegant, small surgeries really at a good moment can help a lot.
I never heard anybody describe surgery with elegance. So Mia, how do people get in touch with you?
So thank you for asking how people can best contact me. I think the email is the best mean because I'm really eager reader. I answer all my emails and it's in the bottom of this page.